So when you're performing a small volume or a low volume solution enema, you're basically taking the same exact steps what you do for a large volume. You want to go ahead and just verify the order, and go ahead and just verify that you have the right patient, and then you want to just go ahead and explain the procedure to the patient, why you're doing it, what the point of it is, and then basically if they just have any questions, you're there to answer them. First, you want to go ahead and just start by, patient privacy, close the curtain, and go ahead and just wash your hands, put on PP that you may need. First thing you want to do is just adjust the bed to a comfortable working height and lower your side rail. That way you're able to get access to the patient. Then you want to have the patient readjust into the Sims position laterally, same position as the large. And then you just want to make sure that you have blankets over the patient, but an open area to where you have access into the buttocks region. So after that, and you already got your gloves on, you're going to go ahead and just remove that cap, and you're going to lubricate the end of the tube the first 2 to 3 inches. Once you do that, you go ahead and just lift the buttocks, get exposed access into the anus. Gently and slowly insert the tube about 3 to 4 inches into the anus. And if you happen to feel any resistance, don't force anything, but just make sure you direct it at an angle towards the umbilicus, and just push a little bit. Make sure the client just takes deep breaths, and have them maybe bear down a little bit if it's a little bit harder portions. Next thing you want to do is, after you've got the tube inserted, you want to compress the solution with your hands in the container with your hands, and then you're going to roll the end up itself, and you're going to roll it up towards the rectal tip. That's how you'll be able to administer all the solution, and make sure you give all the solution that's in the container. And then once you do that, again, you want to assess your patient to make sure they are not, possibly vagling, either from pain or any type of dizziness, nausea, lightheadedness. Seems like anybody's going to pass out. You just go ahead and stop the procedure, and then you want to monitor your patient. Once the solution has been given, you're going to go ahead and remove the tube and keep the container compressed at this time. That's a very key thing. So make sure whenever you do this, when you remove this tube, just have tools and equipment ready for any messes or anything like that, for anything that gets withdrawn or happens to just make a mess. And then just make sure you want to encourage your patient to hold the solution for about 5 to 15 minutes, same as about the large volume. But just if they have the urge to defecate, just please let somebody know so we can help them. All right, and then you're done with the procedure there. You just want to go ahead and remove your gloves and lift that side rail back up. Make sure your patient's in a comfortable position, and put the bed back into a safe, low position. And if you have any other PP, go ahead and remove it. And just ask the patient, if they do defecate and they're not able to wait for us, do not flush. Let us know when they do. We'll come check it out, and then you're good to go. Wash your hands and end the procedure.